Good night, everyone. Just thought I'd try to stay with some consistency here now that I have a little break at work tonight. I thought I'd come to you guys and talk a little bit, just kind of piggyback off my health maintenance video that I did on yesterday and talk a little bit about these people with these fractures that come into the emergency room and even in primary care. I think that I've been blessed enough to see both sides. I do hospital medicine, and then I have a clinic that I do every other week right now. I've been fortunate enough to be flexible with my schedule to do that. So I get to see a lot of primary care and I get to see a lot of emergent medicine as well. So I think it's really important that when we're in primary care that we're doing other maintenance things like vitamin D levels on patients, hepatitis screenings on patients once a year for A, B, and C, all STD studies, whether the patient tells you they've had it, especially in the younger population where they're GYN from a female population or not. Unless you can put your hands on it, you can request the study, you can verify that it's been done, get it. Make sure that you close that chapter and make sure that you know again what your risk stratification are on these patients. Vitamin D levels. If you have a patient with low vitamin D, make sure that if you're treating the vitamin D and you're repeating it quarterly and the patient does not improve the vitamin D, that you get DEXA scans on these patients and make sure they're not osteoporotic or osteopenic or anything like that, or entering into that stage, so you can treat that and keep these people from coming into the emergency room with these profound fractures. Also realize that not just DEXA scans on the elderly population, but remember that a lot of young females are on birth control. Remember, they love the 3-month shot, Depomedrol. I hate it personally only because it takes away the patient's bone mineral density. So these people are having osteoporosis and osteopenia very, very early in life. So even if the patient isn't older, if you see a vitamin D level that is not climbing on a patient despite treatment, make sure that you're doing studies to keep these people at risk from ending up with fractures later in life that can be very debilitating. Syphilis is a big one. I'd hate for you to find out that your patient has syphilis on an ophthalmic exam and it's traveled to the brain. Make sure that you're doing syphilis studies on these patients at least once a year. Even if they tell you that they are not sexually active, just do your once a year screenings. Vitamin D, syphilis, hepatitis is a big one. Big one. I can't say that one enough. C just sits. It loves to just kind of be dormant and then wreak its havoc almost like TB when the patient least expected. I'll never forget I had a patient that was new to me in clinic, and when the patient came to me, I did a silent screening of hepatitis B, very straightforward lady. And what ended up happening is back in the days when she was a dialysis tech and back in the days where they didn't wear gloves, and if anybody is from New Orleans and North Charity Hospital, she actually was a dialysis tech at Charity Hospital, very, very busy dialysis tech, not wearing gloves, and she had hepatitis C. And so when she came to me, she didn't realize it, and she ended up needing treatment for the hepatitis C, but it probably really saved her from some trouble later on in life. So just make sure that you're doing these studies, that you are looking for those elephants. I know in school they say if it walks like a duck and quack like a duck, it's a duck. Remember, you do not need to know everything. Look at what the standards of care is. Look at what the studies are. If something bothers you about a patient, put it in a little note in your phone. I know these smartphones are everything these days, and look it up later. We never stop learning. Fight for your patients. Do these routine health maintenance testing, because sometimes it will really be the make or break in saving a patient's life. Also, if you have a patient that's hypertensive, even if they didn't know they were hypertensive and they come into your clinic and their blood pressure is markedly elevated, make sure you get an EKG on that patient so that you can look for things like hypertrophy of the ventricle, especially if you hear any murmurs on exam. Make sure that you get an echo. This will all be justified with insurance companies. Sometimes these patients have been hypertensive for a very long time and they end up with systolic heart failure. I had a patient that showed up to me who had not had care since he left from jail. Very nice guy. I didn't even get into his business about why he was in jail. But needless to say, he had uncontrolled hypertension. I did an EKG and ended up doing an echo. He had systolic heart failure. He had a bunch of heart attacks he didn't know about. And it really saved his life, and he was very grateful for that. So all I'm saying is, be the advocate for your patients. Always do this testing. Vitamin D, that's big. Get those DEXA scans if these vitamin D levels do not go up. And remember, it's not just the old person's problem anymore, because a lot of young females are on depomedrol shots, which significantly increases their corticosteroids in their bones. So they end up with very brittle bones. Hey, Josette. Thank you for jumping on. Thank you for saying hi. Thank you, Rashida, also for jumping on. Thank you, guys. Anywho, I just wanted to jump in. I'm trying to stay true to profession. I see the DMs. Thank you, guys, so much. You give me life. This is why I do it. So for anybody saying that they were praying to God about whether or not this is for them and they feel like this is a sign, I really believe that this is my calling. This is what God has here for me to do. And I'm going to be straight up forward with you guys as much as I can. Anything you need, DM me. I don't mind. I love you guys. Let's do this medicine. Let's be great. Let's save lives. And if we can't save your life, let's let people die with dignity. Take care, you guys. I love you too, Gisette. Have a good one.